Hello, welcome to the channel and welcome to another video. Hope you will enjoy it. So, we're continuing our series on autonomic nervous system. Currently, in this video, we're going to tackle the ciliary ganglion, which is a parasympathetic ganglion that's located inside of the orbital cavity. So, as all parasympathetic ganglia, the ciliary ganglion has three major roots, and those three roots would be the motor, the sensory, and the sympathetic root, all of which contribute the corresponding fibers to the ganglion. So, since this is a parasympathetic ganglion, the only cell bodies which can make it would be those of the post-ganglionic nerve fibers of the parasympathetic system. The preganglionic fibers would come from the so-called motor or parasympathetic root of the ganglion. These nerves originate from the Edinger-Westphal nucleus or the accessory nucleus of the oculomotor nerve. They travel through the oculomotor nerve towards its inferior branch, and from there they would branch off and join the ganglion. There they would synapse, and from the ganglion the postsympathetic fibers would originate. The sensory fibers, on the other hand, would come from the nasociliary nerve, which is a part of the trigeminal nerve, and they would just cross the ganglion without synapsing. The sympathetic fibers would do a similar thing. They would just cross the ganglion without synapsing, and these three nerve fibers, these three types of nerve fibers, would make the short ciliary nerves that would travel in between the sclera and the choroid layer of the eye. Just one thing about the sympathetic system. Here you can see that there are two options the sympathetic fibers can reach the ciliary ganglion. Either the ophthalmic artery would give off a branch directly to the ganglion, or it would give a branch towards the nasociliary nerve, which would forward it to the ganglion. Same thing happens at the end. But just what happens here? How does the artery give a nervous branch? Now, if you don't remember that, you can refer our video that's discussing the organization of the parasympathetic and sympathetic systems. But in short, the sympathetic system originates from the spinal cord, but on the thoracal portion of the spinal cord. In this case, it would originate from T1, T2, these fibers for the ganglion. They would synapse in a ganglion of the sympathetic trunk, or more precisely the cervical portion of the sympathetic trunk, and from there they would originate as a postganglionic fiber that would wrap around the adjacent arteries. In this case, the internal carotid artery. They would make a plexus around it called the internal carotid plexus, and that nervous plexus would follow the artery along its course, and at the level where the ophthalmic artery branches off the main trunk of the carotid artery, the internal carotid artery, some of the fibers would follow the ophthalmic artery, and these fibers would be for the eye. These would be sympathetic fibers for the eye. Part of them would join the ciliary ganglion, part of them would join the nasociliary nerve, and would reach the eye via the long ciliary nerves, which you should distinguish from the short ciliary nerves, which originate from the ganglion, right? Just to reiterate, long nerves, the long ciliary nerves from the nasociliary nerve, short ciliary nerves from the ciliary ganglion. So, that's the neuroanatomy of the region. What's the function of this guy here? In general, the sensory fibers would reach the cornea and the iris and would innervate them. The sympathetic fibers would innervate only blood vessels, and the parasympathetic fibers would either innervate the sphincter of the pupil and the ciliary muscle, which is responsible for accommodation. Something that you need to realize, or to remember here, is that only 5% of the sympathetic fibers would actually innervate the sphincter, and the rest 95% would reach the ciliary muscle. So, knowing these parts of the physiology of and the neuroanatomy, we can actually explain a rather common syndrome, which is the so-called tonic pupil syndrome. So, the tonic pupil syndrome is a condition which occurs when you have any kind of damage to the ciliary ganglion. It's usually due to either viral infection or autoimmune disease. I will put a link down which you can read for if you're interested in the condition for more information. But in general, this condition would lead to a destruction of the neurons in the ganglion, meaning the parasympathetic neurons. Now, since 95% of those neurons come to the ciliary muscle and only 5 come towards the pupil, the sphincter of the pupil, you can imagine that if you destroy random neurons, there is a much higher chance that at least some innervation would preserve towards the ciliary muscle, and since these guys are very few in number, most likely most of them would die off, which actually happens in these patients. So, what would you expect as symptoms? First of all, since you don't have the parasympathetic tone of the muscle which keeps the pupils smaller, and you have this dilator tone preserved because it's innervated by the sympathetic system, the pupil would be in general at resting position bigger than the pupil of a normal person, right? So the patients with the tonic pupil syndrome would have larger pupils. Something else, since you know that pupils constrict when they are trying to limit the light access to the eye, mainly when you shine a light source in somebody's eye, they would shrink quite fast. This is something that's called the light response or the light reflex. And the sphincter is the muscle that actually makes the light reflex happen. So, if this muscle is denervated, when you shine a light in the patient's eye, the pupil would not react and it would remain the same size as it was during the resting point, while the normal person's eye would dilate quite fast. And after some time, after the main part of the syndrome, the main infection has surpassed in the recovery period, since part of these guys here, the ciliary muscle neurons have been preserved, part of them would kind of grow out and reach the pupil and would re-innervate it. But since that doesn't happen very uniformly, upon very close inspection at large magnification, the borders of the iris would not be very smooth, they would be kind of a little bit jagged. And something else which is actually interesting, the size of the pupil would change along with accommodation because they're innervated by the same neurons. So in general, that's the neuroanatomy of the region. Now, what is the morphology of the region? It's actually quite easy, unlike the anatomy, unlike the neuroanatomy. You just have several small things you need to remember. Here, you see a lateral view of the orbital cavity. And this lateral view, imagine that if this is the eye socket, the bone on the lateral side has been removed along with the lateral rectus muscle. So you expose the optic nerve and the orbit and the bulbus oculi, the eye, from their lateral side. Why have I drawn it from the lateral side? Because the ciliary ganglion is on the lateral side of the optic nerve. Above you would see the levator palpebrae muscle and the rectus superior muscle. Below the rectus inferior muscle, and medial the rectus medialis muscle. So during your dissections, you would not use such an approach. The most often approach that is used in dissection pulse is a cut through the roof of the orbital cavity. So you would remove the bone here and expose these two muscles. If you cut them here towards the eye and reflect them back, you would actually open up the optic nerve and you can see it from above. On the lateral side of the optic nerve, you would see a very small ganglion, which is the ciliary ganglion. It looks like a very small spider, which has these very thin fibers originating from it. Now, keep in mind, it's very large here, but in reality, it's less than 1 or 2 millimeters, right? So it's very, very small structure, very fine. And these fibers are like hair thin fibers, so you need to be very careful during dissections. But in general, once you locate it, you would see that it has two poles, a posterior and a anterior pole. The posterior pole is where the three roots would enter the ganglion, namely the motor root, which brings the parasympathetic fibers, the sympathetic root for the sympathetic fibers, and the sensory root for the sensory fibers. Again, with the keeping in mind that these fibers can either come from the artery itself or they can join the nerve as well, right? And from the anterior pole of the ganglion, you would have this short ciliary nerve which would pierce the sclera that would be bundled up in two main bundles, one from the superior aspect and one from the inferior aspect. There are usually 8-10 of them in total. And while they are reaching the retina shortly before piercing the sclera, shortly before piercing it, they would kind of split in two, so you would get double the amount. And of course, they will run between the choroid and the sclera, which you won't see here, but we already discussed. Okay, so that's the general idea behind the anatomy of this region, behind the neuroanatomy and the macroscopic anatomy. I hope it was useful. If you need something else, or if you have other ideas about videos that you would like to see, comment down below. Like the video please if you found it useful, dislike it if you didn't, and until next time, I hope you have a great day. Goodbye.